Welcome to Substance Use Affecting the Workplace. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. We're very happy to welcome Dr. Bryce Parker and Shawna Meister from the Canadian Centre on Substance Use and Addiction, CCSA. Shawna Meister is a research and policy analyst with the CCSA. Currently, she conducts research on drug-impaired driving and substance use affecting the workplace. Her background includes research and publications on impaired driving, alcohol consumption, substance use and safety-sensitive industries, and substance use and workplace policies. Bryce Parker is a knowledge broker with CCSA. He currently works on substance use affecting the workplace, the National Alcohol Strategy, and the Post-Secondary Education Partnership, Alcohol Harms. He has developed resources on alcohol consumption, community responses to alcohol harms, cannabis use among adolescents, and substance use and workplace policies.
Hi there. As Yusra mentioned, my name is Bryce Parker. I'm a knowledge broker here at CCSA. I'm happy to be here today to talk to you about this topic. It's very important. So substance use is a part of our society and occurs for a number of reasons, including recreation, as part of medical treatment, and as a result of addictions to specific substances. The use of substances can result in impairment that affects the workplace. As a result of this potential for impairment, we received a lot of requests from workplaces, safety-sensitive workplaces especially, to consult and do research in the area. We've developed a few reports. We'll touch on those as we go, and we'll reference those later. So well-developed policy and approach are ways that your workplace can reduce the impact of substance use and impairment on employees, organizations, and in some cases, the public. Substance use impacts the workplace in a number of ways, and there are important factors that contribute to these impacts. The impacts of substance use include absenteeism and presenteeism. So again, the idea of being away from work, but also being present at your role, but not as effective as you would be otherwise. There are a broad range of potential cognitive impairments, depending on the source of impairment. And these would vary widely based on different substances. But for alcohol, these would include judgment and reaction time, as well as the ability to safely use motorized vehicles. Chronic diseases, to take the example of alcohol again, this can include cancers, cirrhosis of the liver, diabetes, and a number of other chronic diseases. Employee morale, a workplace environment may suffer when it is clear that some people are working impaired and are not able to fulfill their responsibilities at work, or potentially putting others in danger in the case of safety-sensitive positions. Injuries, accidents, fatalities, and legal issues are also an unfortunate impact from people being impaired at work or being impaired in a way that affects their work. These also point to the potential harms to other employees or to the public. There are a number of work-related risk factors that contribute to substance use. The profile for different positions within the same organization might include more or less of these risk factors. As a quick aside, so Shawna and I will often refer to employees, but we're definitely referring to all levels of employees. So employees, supervisors, managers, and executives within an organization. Work-related risk factors include access to alcohol and drugs. So you can think of specific positions within the service industry where you have access to alcohol, or healthcare positions where you have access to medication or different substances. High stress, so some employees might be using substances to cope with a high stress position within an organization or with a high stress work environment. Repetitive duties, shift work, and fatigue. The effects of fatigue on decision making are well documented. Tired people are more likely to make unhealthy choices, including choices around substances. People may also use substances to cope with these types of work environments where there are repetitive duties. They're doing shift work and they're experiencing fatigue from their positions. So an overall negative work environment, the overall psychological health and safety of the workplace, can contribute to substance use as well. Finally, meeting with clients or jobs that include entertaining and dining with customers where alcohol and drugs are available can also be a risk factor. So next, we want to talk about the importance of thinking about fitness for duty and impairment in a more holistic way, as opposed to a specific substance policy. So it's important to consider that there are many types of impairment, or impairment can occur from many sources. Lack of sleep. So if someone has had little or no sleep, they may be impaired. Fatigue may occur over an extended shift or night shift and put someone at risk. Of course, substances like alcohol and cannabis, but also prescription and over-the-counter drugs like opioid medications can impair people. Workplace conditions and distractions can impair someone's abilities. Stress, personal or family crises, and as this group is really well aware, mental health can also contribute to impairment. It's important to consider different potential sources of impairment or combinations of sources of impairment in the workplace so that you can successfully address fitness for duty. I wanted to come back to the example that Shawna noted about Nathan. So a bit more about Nathan. Nathan had back pain 3 months ago. He let you know as his supervisor that he was taking prescription opioid medication to relieve the pain. Nathan also let you know that he was losing sleep from the pain, so that between the medication and lack of sleep, he felt drowsy. You worked with Nathan to modify his duties to avoid triggering the back pain and to avoid the use of heavy machinery until he stopped taking medication. In this situation, you worked with an employee who was impaired from a combination of prescribed medication and a lack of sleep that could endanger his and other people's safety.
All right, so what we want to talk about and we want to spend a fair bit of our time on is just how to establish policies and best practices. And we're only going to have time to focus on some of the key ones, but we wanted to start off by giving you a little bit of background about what we found when we started looking at Canadian workplace policies. So for the most part, as Bryce mentioned, there weren't really a lot of businesses who actually had a comprehensive policy. So when we are thinking of a comprehensive policy, we're thinking of one that meets or at least includes 7 to 8 of these components that you see up on your screen. So for instance, objectives and scope would be something that's quite important. Your employees have to know what the purpose of the policy is for and how it applies to them. So for instance, when we talk to some employees and then some of the surveys we've seen, employees don't often know what the rules are when it comes to substance use or how the corporation they work for applies it to them in their scenario. Prevention is another big one. If you want to reduce impairment or any types of issues in your workplace, it's important to make sure you're doing preventive measures such as education and training. Another important part of workplace policies, one which we'll talk about a little bit more about, is how to observe and investigate for impairment. This is something that a lot of employers have approached us about. They're not quite sure how to handle this scenario. Workplace policy should also have a support mechanism built into it. It should not just be a disciplinary type of policy. There should be some aspects to support the employee. An effective workplace policy will also have something on return to duty, return to work, and that's about people coming back to work after having a leave due to substance use disorder. Non-compliance is really essentially explaining to the employee and to employers what constitutes breaking a policy. What are the boundaries? People need to know where they are. Probably the thing we saw missing from almost all policies was review and evaluation for effectiveness of the policy. Some companies do review their policies, but they don't necessarily review whether or not the policy is doing what it's supposed to be doing. And in this case, it's meant to be reducing impairment in the workplace. This one's challenging for some workplaces, but there are ways to be able to evaluate for the effectiveness. The last component that does need to be included in these types of policies is it must meet legal requirements. We're going to talk about this a little bit, but there are laws and statutes around human rights issues as well as safety in the workplace. So there are definitely some legal requirements that must be met with policies when you're building them. So in terms of those first two areas, when it's talking about substance use as part of your policy and talking about how to observe for impairment as part of your policy, the people we recommend you consult with are first and foremost, talk to a medical professional with a specialization in addiction. And if possible, see if they also have a specialization in occupational health and safety. A general practitioner or just your everyday practitioner is not likely going to have the expertise to deal with and help you set up something to do that deals with addictions or with mental health. And so you really want to go to these people who have this specialization in this area. Another really good place to go is talk to your employees. Also talk to individuals with lived and living experience. So these are people who are either gone through an addiction issue or are currently living it. And talk to prevention experts. They can tell you how to appropriately set up some workplace policies, some prevention and education.
Thanks, Shawna. So culture, as Shawna mentioned in part, is very important in this consideration for substance use affecting the workplace. It can be a large barrier to addressing substance use in the workplace. If there's a perception among employees that there's stigma and discrimination, they're not likely to step forward and seek the support they need. It can be partly addressed by ensuring that a policy has a balance of support measures and disciplinary measures. It's important to consider programs like peer-to-peer programs, which are showing some promise and are one potential way to incorporate an element of support in the workplace that minimizes stigma and discrimination. Oh, excuse me. Of course, consult with employees, human resources experts, unions if applicable, and other experts that can help address the culture at your organization. In developing a policy, every workplace needs to consider the legal aspects of their policy. So these include providing a safe working environment that also respects the human rights of employees. Again, this central idea of balancing employer and employee needs. Legally, a substance use disorder is recognized as a disability and needs to be recognized as such within the workplace. In the case of a disability, employers have the duty to inquire if they suspect an employee is negatively affected due to a disability. Employees also have the duty to inform the employer about all aspects of the disability. As you can imagine, it is really important to consult with a lawyer, and depending on your setting and specific questions, a human rights expert might be a good person to consult. So to summarize the policy recommendations that we've been discussing for the last 40 minutes, we want to emphasize that everyone is at risk without a comprehensive policy. So a policy that doesn't balance employer and employee needs, that doesn't address what it needs to in the workplace, leaves organizations and individual employees open to risk. Address impairment of all types. So as we tried to illustrate with our example of Nathan, impairment can come from a number of different sources, and some of those can be relatively common in terms of life circumstances or fatigue or lack of sleep. So it's important that you're thinking about fitness for duty and impairment from different sources. Consider education and prevention as part of your policy and practices so that you're being proactive and having conversations with employees before any potential issues come to the foreground. That central idea of balancing the needs of employers and employees comes up in legal considerations and human rights considerations. So it's very important to balance these different needs and make sure that your policy is balanced itself. Involve everyone in, not everyone, everyone in policy development, so everyone in terms of employees, all necessary experts that you need to reach out to. There could be other types of human rights experts who maybe can help you address the culture at your organization. So making sure that you're involving everyone who you need to develop policy and practices at your organization that are effective. So monitor organizational culture to make sure that employees, like Shawna mentioned, feel comfortable coming forward if they need support. And finally, we've mentioned this at least 3 times throughout our presentation, so evaluate the policy for effectiveness. There are always changes to human rights legislation, to the legal status of employers and workplaces. So while a policy might be effective and be everything that your organization needs at this time, it might not be effective in the future or in the very near future. So it's always important to consider evaluating policy and potentially changing your policy and potentially your approach.